Typhoid fever is an acute disease associated with enteric fever characterized by systemic disease accompanied by abdominal pain and fever with a step-ladder pattern caused by the bacterium Salmonella enterica serotype Typha. Other serotypes, Salmonella paratype A, B, C, also cause similar syndromes but with less clinically significant disease. Salmonella is said to spread by the 4Fs: flies, fingers, feces, and vomits.
Typhoid is very common in developing countries, especially in children, also it's more common in children. This condition can infect people of any age. The main cause of this disease is the bacterium Salmonella typhi. This type of bacteria is also directly related to Salmonellosis, which causes infection in the digestive system. They are worse than typhoid. This disease is easily contagious. Salmonella typhi can be transmitted through the contaminated food and drink. Exposure to bacteria in food or drink can occur when a person does not maintain hand hygiene or eat food that has been cleaned using water contaminated with Salmonella typhi bacteria. Likewise, with drink, make sure you always consume drink with optimal replenishment levels. Contaminated food, contaminated water, raw or undercooked drink or food, infected patient conformities. The new typhoid vaccine works very well in fighting bacteria that are resistant to antibiotics. When a person comes in the direct contact with any of the above mentioned mode or transmission, then they are infected by the bacteria and themselves becomes chronic carriers. Although their symptoms are treated with effective antibiotic, they continue to harbor the bacteria for a long time. Remain asymptomatic and pass it the feces or urine, which again can infect the other people. Typhoid fever is contagious infection that spread from infected person to healthy adult because humans are the only host of the Salmonella bacteria. The main source of Salmonella bacteria include egg, poultry, and turtle. Really, the good microbiota will naturally protect against various infections. However, conditions such as malnutrition and use of certain antibiotics can disrupt the normal flora and increase the risk of infection. This is common in areas with decent population for sanitation and social cause.
Next is the treatment of typhoid. There are two treatments, it's medical treatment and non-medical treatment. But now I'm gonna tell you guys about the medical treatment of typhoid. The medical treatment of typhoid fever depends on local resistance patterns. So in some part of the world, you're gonna have different strains of Salmonella typhi or paratyphi. There could be multi-drug resistance or MDR strains or even extensively drug resistance or XDR strains of this bacteria. And that's gonna change which antibiotics you're gonna use. And generally speaking, the first line of antibiotics that you're going to use for typhoid fever include fluoroquinolones and third-generation cephalosporins. Fluoroquinolones cure about 98% of cases which relapse and fecal carriage rates of less than 2%, and types of fluoroquinolones there are ciprofloxacin 500 milligrams orally twice daily for 5 to 7 days is the most effective fluoroquinolone. And next is amoxicillin 750 milligram orally 4 times daily for about 2 weeks. Next, chloramphenicol 500 milligram 4 times daily for 2 to 3 weeks are all alternative treatments for adults in fully susceptible cases, but they are increasingly met with resistance. And second is third generation cephalosporins. It contains ceftriaxone, ceftazine, and oral cefixime 2 grams once daily for 2 weeks. And for additional supportive therapy and parenteral antibiotics should be continued until 5 days after recovery. And the second medical treatment is vaccination. First vaccine is the intramuscular VI capsular polysaccharide vaccine. It is appropriate for those greater than 2 years old, and it should be given 2 weeks or more before travel, and a booster should be provided every 2 years. The next vaccine is a live attenuated oral vaccine or TY21A strain of serotype Typha. It enhances immunity by stimulating the production of indigenous antibodies. It is indicated for those over 6 years old and is not appropriate for pregnant patients or those with immunocompromised status. And the third vaccine is Typhoid Conjugate Vaccines or TCVs. TCVs was found to be safe among children between 10 years and 6 months of age. The TCVs are also preferred due to the potential for a longer duration of immunity, safety in younger children, and the improved immunogenicity profile when compared to the VI polysaccharide unconjugated vaccine. The third medical treatment is miscellaneous treatment. Symptomatic and supportive care is essential. Maintaining adequate hydration during diarrhea, as well as appropriate ventilation and oxygenation for pulmonary complications, should be provided along with analgesics and antipyretics as supportive care for metastatic complications. Corticosteroids have been suggested for severe cases with encephalitis. The fourth medical treatment is surgery. When gallstones accompany care state, cholecystectomy can be curative. Surgical repair is indicated for complications including peritonitis and ileal perforation. And the fifth medical treatment is prevention through sanitation. Epidemiological data reveals that typhoid is more prevalent in low and middle income countries, in areas with poor drinking water and lack of sanitation. Safe drinking water, sanitation, and avoidance of overcrowding contribute remarkably to this reduction in the number of cases.
Non-medical treatments. Disclaimer: this tip for generic condition. Please seek medical help for more information based your condition. 1. Drink a lot of fluids. Typhoid often leads to dehydration, so patients should keep themselves hydrated by drinking a lot of fluids. About 15.5 cups or 3.7 liters of fluid a day for men, about 11.5 cups or 2.7 liters for fluids a day for women. Second, garlic. It contains antioxidant and acts as blood purifier. It fosters the healing process and boosts immunity of the person suffering from typhoid fever. Eat 2 cloves on an empty stomach. Third, apple cider vinegar. It has acidic. It brings high fever down as it draws out heat from the body. It also contains mineral, which is extremely important for a person who is sick and is losing nutrients because of diarrhea. Mix a teaspoon of apple cider vinegar in water and add honey if needed, and drink before meals. Fourth, cold compress. It is very important to maintain a normal body temperature. It is put on the patient's forehead, armpits, feet, and hands. Applying cold compresses on the extremities brings down the fever effectively. You can also soak and washcloth in icy water, wearing out the excess water and place it on your forehead. Change the washcloth frequently.
Okay, next preventions. 1. Wash hands with soap and running water. 2. Food was cooked properly and still hot when served. 3. Avoid raw meat. 4. Wash fruits and vegetables carefully. And the last, avoid ice unless it is made from safe water.